Hello, my name is Antonio. I will be performing my head to toe assessment today. I'm going to begin by scanning my environment for anything, make sure there's nothing there. There's my subject. I will be having him hold a phone flashlight. Unfortunately, I misplaced my pen light. So he will be holding that through the duration of the head to toe assessment, and when I need it, I will use it for whatever portion and also show the screen to make sure there's nothing on it. That being said, walk in. Hello, my name is Antonio Rosa. I'll be performing your head to toe assessment today. What is your name and date of birth?
Jameson Michael, 9/17/2001.
Perfect. Do you consent to being filmed for this video?
I do.
Okay, good. Alrighty. Do you have any allergies that you know of, and are you in any pain currently?
No.
None?
No.
Okay, perfect. I'm just gonna come over here and wash my hands real quick, okay? Put on some gloves. We're going to give you some privacy too. Just close this curtain, okay? Alrighty. Do you know what you had for breakfast this morning?
I had a sausage, egg, and cheese sandwich.
Okay. What about 4 presidents? Could you name some for me?
George Washington, President Lincoln, Theodore Roosevelt, and Barack Obama.
Perfect. Do you know where you are right now?
I'm at the doctor's.
Who am I?
My nurse.
Good. And do you know what day of the week it is?
It is Sunday.
Okay, good. I'm going to inspect for general mood, affect, speech and language seems to be intact. Your dress seems to be healthy as well as your general hygiene. That is all good. Your mood seems to be happy. Well, maybe not happy to be here, but everything looks to be about good. I'm also going to inspect your skin for skin pigmentation and hair distribution, as well as your scalp. I'm going to inspect your scalp for color, texture, and hair distribution. Any presence or absence of lesions or nodules. Okay, seems to be symmetrical. That's good. I'm going to inspect for your ear placement. Make sure that they are equal in position. They're good. Your eye alignment, good. Your lash condition seems to be healthy, as well as your eyebrow placement. That seems to be good. I'm going to inspect the external nasal structure for any lesions. Seems to be good. We're going to take a look at both ears. There's no cerumen, drainage, or lesions noted. Okay. All right. Can you whip out that flashlight for me? All right. We're just going to show the screen here real quick. I'm going to just tilt your head up for me, okay? I'm going to inspect the nasal turbinates for color, any drainage, lesions, polyps. I see none. Good, good, good. Okay. We're also going to take a look into your mouth real quick. So can I see the light one more time? Showing the screen. We're going to take a look. Open up. Look at the mucosa. Sublingual mucosa. Can you lift your tongue for me? Good. Can you pull your cheeks down, your lips down for me? Sorry, not cheeks. Gonna look at the gums and check for any gingivitis or erythema and color. Hydration seems to be good. Open up for me again. Papillae on the tongue look to be good. No lesions, normal moisture. As well as the mucosa. I'm gonna inspect the hard and soft palate. Make sure everything looks midline. You have a good fusion line. Again, I see no lesions. Can you stick your tongue out for me? I'm gonna inspect posterior pharynx. The uvula looks midline. Tonsils are present. I see no exudate, no erythema, no swelling, and no lesions. Good, good, good. Okay, so I will hand this back to you. Perfect, perfect. I'm going to move on to begin palpating some structures on the face, okay? So it means I'll be touching your face.
Okay.
So I'm going to start by palpating the frontal and maxillary sinuses. Is there any tenderness? The external nasal structure, any tenderness with that?
No.
Good. I'm going to palpate the lacrimal apparatus. No tenderness, right?
No.
Perfect. Just going to tug on your ear here, okay?
Okay.
So I'm going to tug on the pinna and press on the tragus. Any pain?
No.
Good. We're gonna do the same on this side. Any pain?
No.
Alright, I'm gonna palpate the mastoid region. Any tenderness here? Okay, good. Alright, seems to be good. I also just want to know I'm inspecting the lids for any ptosis, edema, or lesions. Good. And I'm just going to do a general feel on your face, okay?
Okay.
I'm going to palpate for any tenderness, texture, temperature, edema, or masses. Everything seems to be good. Alright, and there was no pain, right?
No.
Okay, perfect. Now I'm just going to move on to palpate your carotid pulses individually, bilaterally. So we're going to start here. Okay, and I would stop at 30 seconds right now. I can multiply that by 2 and make sure that your pulse is within normal range. I'm also going to do the same on the opposite side. I'm going to palpate this pulse for, I would for 60 seconds. For the sake of the video, we'll do 30. Okay, so palpating that side for 30 seconds as well, I would multiply it. I would state that your pulse is 2+ bilaterally. It's not bounding, seems to be good. I'm also going to move on to just take a listen to your carotid pulses. Again, listening for a full minute for any evidence of bruise. We're going to do the same on this side. Again, noting, listening for that full minute. There's no evidence of bruise. I would say sounds good. Pulses are equal bilaterally. I'm going to have you do a couple motions for me. Can you open and close your jaw for me? Can you move it side to side? And can you push it forward and back? Good. Good range of motion of the jaw. I'm also going to move on to assess JVD. I'm going to move your bed to 30 to 45 degrees at angle and just ask you, can you look over that way for me? Fully. Can you look all the way? Thank you. Okay, and the opposite way? Okay, I see no evidence of jugular venous distension. That all seems to be good. So, that being said, we will move on to your anterior thorax. I'm just going to ask that we move this down. We'll put it down to maybe just your lap there. Expose your chest for me. That works perfectly fine. So I will inspect the anterior thorax for hair distribution and skin pigmentation, as well as any scars, evidence of bleeding, lesions, and moisture. Same on the post here. Sit forward for me a little bit so I can see. We're going to inspect for skin pigmentation and hair distribution, as well as any scars, evidence of bleeding, lesions, and moisture. Seems to be good. I'm going to take a look at your anterior chest wall. I'm going to inspect the precordium for the apical pulse. Apical pulse is absent for visualization, which is okay. All right, I'm just gonna take a look at the antero-posterior diameter. So just sit forward for me. Seems to be a good diameter, no barrel chest or anything of the sorts. Good, good, good. Okay. I'm going to move on to the posterior side, okay? We're just gonna have you take a breath in. All right, we have bilateral equal chest expansion. I'm gonna tap on my hand on your back, okay? Just tell me if there's any tenderness.
No pain.
No pain?
Nope. No pain.
No pain?
Nope.
Good. So, no CVA tenderness noted, and as I said, good chest expansion. It is equal bilaterally. That being said, we're going to move on to some more palpation. I'm gonna just palpate here for your apical pulse. Again, really palpating for that minute to get the pulse. For sake of video time, about 30 seconds. Okay, so pulse is normal, not bounding, that's good. So now I'm just gonna go on, just feeling over the whole general area, okay? Let me know if there's any tenderness. I'm gonna also feel for texture, temperature, tenderness, masses, or edema. Any tenderness noted? Nothing? Okay. Move on to the back side. No tenderness?
Nope.
Alright, anterior and posterior seems to be good. Alrighty, we're gonna move on to taking some listens to your lung fields, okay?
Okay.
When I place my stethoscope down, just take a breath in and breathe fully out for me. Okay, I'm gonna identify bronchial breath sounds, bronchovesicular and vesicular. Bronchial breath sounds. Bronchovesicular and vesicular. Okay, I'm gonna move on to the back side, okay? Same process, just take a breath in and fully out for me. I'm just going to turn you here. Okay, I'm going to identify bronchovesicular as well as vesicular lung sounds. Bronchovesicular. Vesicular. Okay, no adventitious breath sounds are noted. You have good rate, rhythm, and depth of your respirations. So that's good. We're going to take some more listens now. I'm going to move on to listen to some of your heart sounds, okay? So. We're going to begin at aortic. Pulmonic. Herbs Point. Tricuspid. And mitral. Okay. I'm going to take a listen again with my bell side to the stethoscope, the same areas. Again, just noting that, I'm listening for that full minute for sake of video. Go a little shorter. Pulmonic. Oh, I'm sorry, aortic. Pulmonic. Herbs Point. Tricuspid. And mitral. Okay, you have normal S1, S2 heart sounds. No extra heart sounds were heard. Okay, so that's good for anterior and posterior. We'll cover you up real quick. And we're going to move on to some different testing, okay? So we're going to test your cranial nerves real quick. First one being, we're going to do a smell test for cranial nerve 1. I'm going to have 2 cents. For sake of video, I do not have 2 cents with me. So chocolate and vanilla. Can you close your eyes and cover your left nostril for me? All right. Can you smell this scent? All right. Now cover the opposite nostril and smell this side. And open up for me. What did you smell on this side?
Vanilla.
And this side?
Chocolate.
Perfect. Cranial nerve 2, we're going to do a Snellen chart. Just verbalizing it for the sake of the video. But I would have you look and read down to the lowest line to test your visual acuity. Cranial nerves 3, 4, and 6, we're going to test your extraocular movement. So, can you just follow my finger? All right, and do you have that light?
I do.
We're also going to test pupillary reflex to consensual light. Just look straight for me. Okay, here's that. All right, pupils are equal and reactive to light and accommodation. That is good. So we're going to move on to just do some facial expressions for me, okay? We're testing facial nerve. So you smile, frown. Can you puff your cheeks out? Raise your eyebrows. And can you close your eyes for me? Perfect. Alrighty. We're also going to test your hypoglossal. Can you stick your tongue out for me? Okay, good. And glossopharyngeal, just verbalizing, I would also elicit your gag reflex. We're not going to do that today. Can you open your mouth and say ah for me? Okay, so that means vagus nerve is intact, uvula remained midline and did rise. I'm going to take a feel on your cheeks here. Can you clench your jaw? Okay. Trigeminal nerve also seems to be intact. I'm going to have you, can you just raise your shoulders for me? It's resistance, good. And try to turn your head against my hand. Okay, that's good. So spinal accessory is also intact. We're gonna do a quick whisper test. I'm gonna whisper in one ear. I just want you to repeat what I said, okay? All right, can you cover the opposite for me?
Chicken.
Yes.
Christmas.
Perfect. All right, so acoustic nerve is also intact. That would be the conclusion of our cranial nerves. We're gonna move on. I'm just gonna take a look at your back real quick, okay? I wanna inspect for kyphosis, lordosis, and scoliosis. I do not see evidence of any of that. I'm gonna also palpate while inspecting your spine. Is there any tenderness?
No.
All right, I see no abnormal curvatures. Everything's as to be expected. Definitely no tenderness. That seems to be good. All right, can you laterally bend for me? Go like this. Can you twist? And can you bend your back? Can you bend it back up and kind of hyperextend for me? Good. All right, everything seems to be good on that. We're gonna expose your abdomen now, okay? And I'm just gonna start by asking you some questions. We assess what's going on. All right, do you have any burning or stinging when you urinate?
No.
Okay. Do you have any difficulty starting or stopping your stream?
No.
What about your last bowel movement? Do you know when that was?
This afternoon.
This afternoon? Okay. Is that normal for you?
Yes.
Okay. Alright, I'm just gonna start by inspecting for skin pigmentation and hair distribution. Good. I'm also gonna inspect for any scars, evidence of bleeding, lesions, or piercings. I see none. I'm gonna inspect for the symmetry and the contour of your abdomen. Seems to be good, as well as the condition of the umbilicus. Looks to be good. All right, everything seems to be intact. I'm gonna take a listen to the 4 different quadrants of your abdomen, okay? And for sake of the video, I would listen for a full minute on each side and 5 minutes if I suspect absent bowel sounds. I will be listening for 30 seconds. Okay, bowel sounds are present in all 4 quadrants. I'm gonna move on to just palpate your abdomen real quick, okay? Let me know if you feel any tenderness.
Okay.
Any pain? Okay. And I was palpating for texture, temperature, tenderness, edema, or masses. Everything seems to be good to me. That was good. All right, you can go ahead and put the gown back on for me. All right, we're gonna move on to your upper and lower extremities, okay? I'm gonna inspect for skin pigmentation, hair distribution on the legs as well as the upper. Okay, size and symmetry seems to be good. I see no muscle atrophy or contractures. I'm gonna inspect the lower legs for varicosities. Alright, no evidence of varicosities. Okay, now can you just do some movements for me? Can you go like this with your arms? Circumduction. We're gonna do abduction, so go up and abduction. Good range of motion of the shoulder. We're gonna test shoulder girdle strength. Push against my hand. Push. Same on this side. Good. All right. Now, can you bend your knees for me? Both sides. Okay. Flexion and extension is good in the knees. Okay. Can you push against me? And push. All right. Same with the feet. Can you push your feet upwards against me? And press onto my hands. All right. Good. Good strength of the knee joint as well as the ankle. That's good. All right. I'm going to move on to palpate your joints. We're going to check for warmth, crepitus, tenderness, or masses. No tenderness? Okay. Same here. Any tenderness?
No.
All right. And the knees. Can you bend your knees for me? All right. No crepitus, no tenderness, no masses, and a good temperature. Okay, good. Alrighty, I'm gonna move on to palpate some of your pulses, okay? Again, for sake of time, I would palpate for a full minute to get that pulse. We can do 30 seconds and multiply by 2 to get your pulse. So we're gonna come here and feel these.